For many years of my life, I've been living with a medical condition called Postural Orthostatic Tachycardia syndrome, which is often abbreviated as POTS. In a nutshell, POTS is a condition in which the heart races very quickly whenever a person stands up. When a person sits down, the heart rate slows back down. Now, this is a very simplistic view of POTS. POTS causes dizziness, fatigue, headaches, shortness of breath. POTS can cause a lot of symptoms. In the last 5 years, POTS has really risen to the surface, and a lot of people are becoming very aware of the medical condition. Unfortunately, there are some misnomers about POTS, which has permeated into the medical community and abroad and has caused people to have misconceptions. One of the misconceptions people have regarding people who have POTS is that POTS causes low blood pressure. This is a little bit of an error. Now, POTS is simply an increase in the heart rate of at least 30 beats per minute or a heart rate of 120 beats per minute or more within 10 minutes of standing in the absence of orthostatic hypotension. Unfortunately, this gets really confused and complicated for people because there are people who have another medical condition called orthostatic hypotension, also known as postural hypotension, is a medical condition wherein a person's blood pressure drops when they are standing up. It is defined as a fall in the systolic blood pressure of at least 20 millimeters of mercury or diastolic blood pressure of at least 10 millimeters of mercury after 3 minutes of standing. Postural hypotension means whenever they stand up, their blood pressure drops. Unfortunately, people get orthostatic hypotension and POTS often confused. POTS is part of an umbrella condition called dysautonomia. Dysautonomia is a dysregulation of your autonomic nervous system. Your autonomic nervous system controls everything that's automatic: your heart rate, your blood pressure, sweating, food digesting, and anything else you do not consciously think about. It is primarily your autonomic nervous system which is controlling all those functions. Now, I have a subset of POTS called hyperadrenergic POTS, or hyperPOTS for short. With this condition, whenever I stand up, my body releases a lot of catecholamines. So once I stand up, my catecholamines shoot through the roof. In response to this, my heart rate goes high and also my blood pressure. Now, this can cause a lot of confusion whenever I go see a doctor, because if I'm moving around or if I'm upright, my heart rate and my blood pressure will both elevate in response to just that increase in catecholamine levels. And then once I sit down, my heart rate usually will drop down to 70, 80, 90 beats per minute, which the doctor is happy about because anything under 100 beats per minute, they like to see that. But my blood pressure is not so responsive. It takes some time. It takes about 5 to 10 minutes for my blood pressure to work its way back down to a normal level. So whenever I get my blood pressure taken at doctor's offices, it can be quite high. Now, when the doctor sees this, they say to me, "Oh my, you have really high blood pressure. You need to cut back on that salt. You're eating too much salt and you need to limit your water intake. That should help get your hypertension under control." This is totally wrong because my blood pressure is only ever elevated when I'm upright. When I sit down, it usually goes back to normal. And then when I lay down, it actually goes really, really low. And one of the treatments for POTS is eating lots of salt and drinking lots of water. And I find if I do that, my heart rate does not dramatically swing so much. It goes high, but it does not go as high as what it used to do before I started eating salt and drinking water. So I just say, okay, thank you, doctor. And I hope the doctor does not write that in my chart. If I happen to be in the hospital and I happen to be up brushing my teeth, da 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 da, and they're like, "We want to take your heart rate and blood pressure," and I'm like, "Not right now because I am standing brushing my teeth and my heart rate's going to be high, my blood pressure's going to be high, and you're going to get all concerned." But sometimes they don't listen, and they're like, "No, we need to do it," and I'm like, "Wait, let me sit down." But of course, my blood pressure is still quite high, so they will take my blood pressure and they're like, "Oh, your blood pressure is so high. We gotta let the doctor know about this. And I'm like, no, really, I was standing and brushing my teeth. It happens. I have hyperadrenergic POTS. It happens. Definitely happens. But of course, nobody listens. Nobody listens. So the doctor will be contacted, and guess what? I will be placed on fluid restrictions and a salt-limited diet. And a funny thing happened. They kept decreasing my fluids and my sodium, and my blood pressure kept going up and up and up. And it got really dangerously high. And the doctor was like, I don't understand this. Why is your blood pressure going so high? And I said, because I have POTS and I need fluids and I need salt. You give me fluids, you give me salt, my blood pressure will go back down to normal. Right now, my body is in extreme stress because it is very short on fluids and it is doing everything it can to preserve fluids and to preserve my blood pressure. And it's just overreacting and giving me really high blood pressure. The doctor did not believe me, but I started increasing my salt intake and my water intake. I had people bring me food from outside, and then my blood pressure dramatically dropped. And then the doctor was like, see, it is working. And I said, no, look at all these bottles of water. I drank all that. And you see, I have a thing of salt right here. I've been eating that, and now my blood pressure went back down to normal. I don't suggest doing that. The doctor got really mad at me because I was clearly going against the advice. And I really wasn't, because I was actually following my POTS doctor's advice. So that's one issue with having POTS, is my blood pressure can go really, really high, and it confuses people. So whenever I go to the hospital, I insist. I'm like, no, you cannot do my blood pressure or heart rate whenever I'm standing up. Please, I need to be sitting down and relaxing. So now I actually look at the clock, and I can pretty much anticipate whenever they're going to do my vitals, because they pretty much do them every 4 hours. So I'm like, oh, almost time for vitals. Nope. I don't care how much you have to go to the bathroom. You're just going to have to sit there and hope they come soon, because I'm going to float away because I've been drinking a lot of water. And so whenever they take my blood pressure, I'm like, please, okay, got my heart rate and my blood pressure, great. Gotta go. And they're like, you didn't have to wait for me. And I'm like, I did have to wait for you, because I don't want to be in fluid restrictions. It doesn't work so well for me. Another thing that happens with my heart rate and blood pressure, my body overcompensates. So my heart rate and blood pressure go really, really high whenever I stand up. When I sit, heart rate and blood pressure, pretty much normal. When I lay down, my blood pressure and heart rate go low. Whenever I lay down, my heart rate immediately drops down into the 40s. That's terrible. Terrible when you're in the emergency department and they're monitoring your heart rate. They don't care my heart rate's in the 40s. It's just, they have that little monitor, and it's just like beep, 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 beep. And I'm like, shut up. I know my heart rate's in the 40s. Shut up. And then I get really upset, and then my heart rate starts beating a little bit faster, and then my heart rate increases enough, and then it shuts up. And then I'm like, oh, so glad that monitor shut up. And then I relax, and then it goes beep, 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 because again, my heart rate dropped. So annoying. And then also my blood pressure goes low whenever I lay down. So if I'm in the emergency department and they're checking my vitals frequently, I have the little blood pressure thing that's alarming because my blood pressure will go low, and then the heart rate thing will be alarming because my heart rate went low. And yes, I do bring earplugs. I do bring these along with me to the emergency department. Some people think in some of my videos these are headphones, and I'm like, yeah, headphones, wireless headphones. No, these are earmuffs to block out the noise, because I always have that machine that's beeping to allow everybody to know, only me, that's the only person that really hears it. Let me know my heart rate and blood pressure are low, because my body's overcompensating. I had this also happen whenever I'm in the hospital. My heart rate and blood pressure goes low during vitals, but I sometimes just want to see what happens. I'm so tired. I'm just like, no, I'm not moving. And they're like, oh my goodness, your heart rate's in the 30s. And I'm like, oh yeah, I'm really tired. And then they do my blood pressure, and they're like, oh, it's really low. We're really low. You need to sit up. And I'm like, no, I don't want to sit up, because then my heart rate and blood pressure go up, and then I can't sleep. So they sometimes make me sit up, and I'm like, okay. they're like, okay, now we're going to take your blood pressure. Oh, it's normal. It's normal. We're so glad it's normal. And I'm like, oh, my heart rate's normal now too. Isn't that? Oh, it's now 80 beats per minute. Oh, it's now 80 beats per minute. Yeah, I'm definitely feeling that. I need to go lay down again. And they're like, no, no, your blood pressure's going to drop. And I'm like, oh, I can't sleep sitting up. That doesn't work so well because my heart rate's too fast. They're like, you can't lay down. I'm like, okay, I'll just sit here for the rest of the night. And they're like, oh, great. And so they close the door and I'm like, and thankfully they don't come back for 4 hours. So they don't know I go to sleep. I know I shouldn't be so rebellious, but it's POTS and it's totally normal. I had this happen one time in the intensive care unit. They were monitoring my heart rate and blood pressure. And I explained this to them. I'm like, it goes low during the night. I'm just letting you know this. Can you shut off the machine that it stops beeping? They're like, oh, yeah, no problem. So they got it. So the machine was quiet. However, one night I had a nurse and he was like, your heart rate's in the 30s. It's in the 30s. He came in a panic. Wake up. Heart rate's in the 30s. Wake up. And I was like, oh, good. I was sleeping. I was really getting some nice sleep. My heart rate was in the 30s. Great. They're like, you need to wake up. Your heart rate is too low. And I'm like, hey, man, I'm on a ventilator. I'm still breathing. I'm fine. So the nurse either didn't see on my chart that was noted or decided 30 beats per minute was a little too slow. It has gone down 27 beats per minute. That was a record for me, 27. But it didn't happen that hospitalization. It happened another time. But it was in the 30s, and the nurse was like frantic, calling the overnight doctor. Doctor, her heart rate's in the 30s when she's sleeping. We need to do something. So they gave me a medicine that when I was laying down, my heart rate was in the 80s. Yeah. Heart rate in the 80s. Not good. Not when I'm laying down. It's like boom, boom, boom. Oh, I was in so much pain. And then I sat up and then my heart rate was 120 beats per minute. Heart rate 120 beats per minute when sitting up. Oh, that's just joyous. Just unbelievable. And I didn't even try. I did not even try standing up because I was like, no, I want my heart rate to calm down. So I was like, please turn this off. I can't sleep like this. I cannot sleep. And I was just begging the nurse and begging the nurse. And finally the nurse turned it off. And I was like, thank you. But then unfortunately the medicine was in my system. So for the rest of the night, I couldn't sleep. And I had such a horrible headache and my heart was just pounding and pounding and pounding. My heart rate did eventually go lower, but my chest was just so sore and my heart was just pounding so hard. Oh, I was so sick for a couple days afterwards. The next day, my regular doctor saw me and he's like, oh, yeah, I saw they really overreacted last night. I am so sorry. No, there was no need for that. You were still breathing. Your rate was still in the 30s. I mean, you're fine. They were just way overreacting. I'm so sorry. I'm going to put a note in your chart that they shouldn't do that again. And thankfully, because the doctor felt so bad, he decided maybe being in the hospital was not the right treatment course for me. So thankfully, because I had a PICC line, he allowed me to go home. And he just sent me home on the intravenous medicine I was receiving in the hospital. He sent that to the pharmacy and he just sent me home. And he's like, just go home and get some sleep because I was so sick from having a night of a fast heart rate. One other thing happened is after surgery, my heart rate goes really, really fast. So unfortunately, whenever my body gets really stressed out, such as surgery, I can't move at all. I'll be laying completely flat and my heart rate will be like right at 100 beats per minute. If I just turn my head, it'll go over 100 beats per minute. If I sit up, it'll go to 130, 140 beats per minute, 150 sometimes. And then if I have to stand up, if they make me like stand up to go into a wheelchair or stand up and make me use a bedside commode, that I cannot even explain to you the tragedy that is. Several years ago, I had surgery and my POTS was just out of this world awful. I couldn't get my heart rate under 100 beats per minute. And the nurse saw this. She was kind of concerned, but I just said, I have POTS. It's going to happen. My body's really stressed out. And then she told me, you're going to have to urinate, or we're going to have to make sure you can urinate before we discharge you home. And I said, that's not possible because I'm going to have to move and my catecholamine levels are going to skyrocket. And if you've had high catecholamine levels, your body does not allow you to urinate. Yeah, that's quite problematic. But she's like, no, no, we need to make sure. And I'm like, I assure you, if I don't have to move, I can urinate, but I can't move. Even just lifting myself up to try to get onto one of those little bedpans, that's going to elevate my heart rate too much. I'm not going to be able to go. And she's like, no, no, I'm sure I'll be fine. So she got a bedside commode and I sat up and there went my heart rate, 140 beats per minute. And she goes, wow, your heart rate's really fast. I'm like, yeah, it's going to go faster now. It's going to go faster. And she's like, really? And I'm like, yeah. So I transferred over to that bedside commode, 200 beats per minute. That was just exciting. She's like, oh my goodness, does your heart rate always go that fast? I'm like, no, only when I had surgery. Only when I had surgery. Look at that heart rate go. So I sat in the commode and I was like able to get a couple drops. And I was like, look, honey, this just is not going to work. My heart is just, I have to lay down or do something because I can't go when my heart is beating this fast. And so thankfully, because I went a tiny little bit, she's like, okay, we'll let you go. So I went home, I laid down and I was like, okay. And then you're like, how did you go to the bathroom? Well, when I get really, really sick like that, I can't sleep in bed because I can't take the adjustment between the bed and then even just transferring into a wheelchair or crawling on the ground. I can't take that elevation adjustment. So what I have to do is sleep on the floor and then crawl on my stomach and just inch myself forward on my stomach without raising my body at all, keeping it flat. And then when I get to the toilet, I have to very, very carefully get myself up on the toilet and then wait about 15, 20 minutes to allow my heart rate to go back down and then go to the bathroom like I've never gone to the bathroom before, because you really have to go when you have all this stuff and you can't go. Another thing I have done, and I don't like to admit this, but in case you have POTS and you need some ideas, or you know somebody that has POTS and needs some ideas, I have a walk-in shower. So I'm just saying you can inch yourself forward, get into the walk-in shower, and kind of get yourself in the general ballpark of where the drain is. And yeah, you can pee pretty quickly, easily, but then you kind of got urine all over yourself. But hey, that's why you're in the shower, and that's why you're like, hey, somebody turn the shower on. So you get a shower when you're there. It's quite exciting. So not only do you get to go to the bathroom, you get showered and bathed at the same time. So much fun. So those are some fun adventures with having postural orthostatic tachycardia syndrome, and specifically having hyperadrenergic postural orthostatic tachycardia syndrome. Makes life a little bit challenging, and unfortunately people don't often listen to things I have to say, and it just can lead to a lot of complications, especially in the emergency department, where they don't understand what's a normal heart rate, what's a normal blood pressure. And they sometimes, if you come in and your heart rate's really, really high and your blood pressure is really, really low, which happened to me recently with sepsis, they said, you have POTS, so your blood pressure is noted to go low and your heart rate is noted to go high. So this isn't concerning, and it should have been concerning because I was really, really sick and I was not standing and I was not laying down. So remember, sitting, my heart rate should be normal, my blood pressure should be normal. And they failed to realize that, but I don't fault them because everybody gets confused with my heart rate and my blood pressure. And I feel like I should just have a shirt be like, okay, when I'm standing, heart rate high, blood pressure high. When I'm sitting, blood pressure normal, heart rate normal. When I'm laying down, blood pressure low, heart rate low. If anything else happens and it doesn't accord with this general chart, abnormal, suspect I might be sick, I might have something majorly wrong happening. Anyways, so thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day, a wonderful week, and happy Dysautonomia Awareness Month. Bye-bye.